I'm Gina Crash with the today's 101.9 morning show. Welcome to our Facebook Live today with Gbmc's Dr. Robert Donegan. He is an oncologist and a hematologist with the Sandra and Malcolm Berman Cancer Institute at Gbmc. Thank you for being here, Doctor.
Great to be here, Gina. Thanks.
We're so excited to have you, and we're going to explain a little bit later why we have Chase, the Awareness Cancer Ribbon Horse, with us up on stage. It's a very special announcement. At the end of our Facebook Live, we'll tell you how you can participate and add ribbons to him, and where we're going to be able to do that. It might have something to do with Towson this weekend, if we can tease just a moment. And we're really all so excited to have you here, because as soon as we told folks on Facebook that we were going to do this, the first thing they all said was, oh, we love Dr. Donegan. He's such a wonderful doctor and also a wonderful person. You have that personalized approach. So I just wanted to begin by asking how important that is when you're looking for an oncologist in the cancer journey. Is that something you should look for, and how does that help in thriving and surviving?
I think it is important. I mean, I think these are very important relationships that hopefully go on for a very, very long time. And I think you have to feel trust, you have to feel comfort in being vulnerable in front of your doctors and talking about whatever it is you need to talk about. So I think a good working relationship is really critical, and I think you need to find that out at the beginning, because, like I said, it's going to be a long, long relationship, hopefully.
Excellent. It sounds like that has definitely worked for you and your patients over the years. Uh-oh, the poor horse. And I think we're going to begin with, obviously, the beauty of Facebook Live is being able to answer these questions as they come in from viewers who want to ask them. So the first thing we have here, I've heard different sources state that cancer survivorship starts at diagnosis, but others say survivorship starts when you get your first clean scan. What are your thoughts on that, Dr. Donegan?
Yeah, so I think survivorship means different things for different people. I mean, if you look at it in the most simplest of ways, anybody that's been diagnosed with a cancer from the moment they've been diagnosed is a survivor. But it takes on different forms. Some people will personalize it that it's when they actually finish their initial treatment. Some will, as you said, when they have their first scan, that's negative. I think it really is a personal way of looking at it. But technically, it's anybody diagnosed with the cancer, both early stage cancer and people that are living with advanced cancer. They're all survivors.
Excellent. Great answer. And I think we're just going to go in order here with our... great. Here's another great one that just came in. After cancer treatment, how often should one follow up with their physicians? Meaning their oncologist, their radiation oncologist, or their surgeon? That's a great question. Yeah,
so there's not a set rule. It's very individual to the circumstance. A lot of it depends upon what type of cancer it was, what stage it was, what different doctors were involved in the care. Sometimes if somebody's living with an advanced cancer, they're going to be seeing their doctors quite frequently because they're being monitored for side effects and toxicities of therapy, scans to look and see if the treatment is working. Somebody who's had an early stage cancer that is hopefully cured of their cancer, their follow-ups may be less frequent, maybe every 4 to 6 months rather than every several weeks, depending upon the circumstance. So it really is unique to the circumstance.
Great, excellent. Our next question, it says here, after a cancer diagnosis, should all patients seek genetic counseling to find out if there's a genetic link to cancer? You hear that a lot these days. Is that something you recommend?
So to answer that specifically, should all patients? No, I wouldn't say that all patients should, but there certainly are some that should. Genetic predisposition to cancers are something we're becoming much more aware of. Indeed, there's been many more genes that have been discovered in the last 10 or 15 years that have helped us better understand why some cancers occur. But the genetic predispositions probably only occur in about 5 to 10% of patients. So we don't want to send everybody off to the geneticist. What we look for are signals that suggest that there might be a genetic predisposition. So we look at the type of cancer that the patient has, because some are more likely to be genetically predisposed than others. We look at the age of the patient. If they're young, that might be a signal that there's more likely a genetic predisposition. And importantly, we look at the family history. So are there lots of different types of cancers within the family, especially the close-in family, that suggest a genetic predisposition? And if the answer to those questions is yes, then absolutely we send them off to the geneticist so that they can be educated, counseled, and most likely tested as well.
Great, great. That's very thorough. And then here's a question coming in after a mastectomy. Chemo and radiation, how often should a breast cancer survivor get their mammograms? Does that change after that?
So if they've had a bilateral mastectomy, which sometimes women will choose to do, then mammography really doesn't play a role at that point because there's really not any breast tissue left to look at by mammogram. If they've had one side removed with a mammogram, or with a mastectomy, but there's a remaining breast, then generally we recommend a once-a-year mammogram. Sometimes, depending upon what is found, we may shorten that to 6 months for a period of time, but generally it's a once-a-year follow-up with a mammogram.
Excellent. Good answer. I think we have a live question here right now. Okay. I'm a non-Hodgkin's lymphoma survivor. I've been cancer-free for over 7 years. And what are the recurrent statistics for that?
So it all varies. So non-Hodgkin's lymphoma is really a broad array of different sub-diseases. So there are forms of non-Hodgkin's lymphoma that, like our governor had, that are rather aggressive forms that, when treated aggressively, many of those patients are ultimately cured. If they're going to recur within the first several years, and then if they're not coming back, they're probably safe. Then there are non-Hodgkin's lymphomas that are very slow-growing lymphomas that we don't necessarily cure. And those patients can live a long time with their lymphoma, but they need to be followed regularly because they're forever at risk of the lymphoma regrowing. So it really depends, the devil's in the detail as to what the specific type of lymphoma it is. Is it an aggressive one where there's intensive follow-up initially and maybe less intensive afterwards, or is it a less aggressive one where longer follow-up is necessary?
Gotcha. Wow, that's one that came in live as we are mastering how to get these questions as they come in live. This is fun, isn't it? This is a whole new
thing.
A whole new frontier, isn't it?
Yeah, sure.
Thank you for being here again, Dr. Donegan. Our next question says, how often should a cancer survivor get blood work, scans, x-rays, etc., after treatment has completed?
So again, there's no set rule to this because it is so individual to the particular circumstance. Dependent upon the type of cancer, dependent upon the stage of the cancer. And I'll offer you two extremes. So for example, in a young man that has testicular cancer, who's been treated and hopefully cured with therapy, we know that identifying a recurrence early is very important because that can make them do better in the long run. So those patients are followed very closely with blood work and with x-rays in order to be able to act as soon as something should reemerge. On the other hand, a woman with early stage breast cancer, detecting a recurrence earlier versus later when it's causing a symptom doesn't really make a difference in how she's going to do in the long run. What's really going to make the difference is how well she responds to the therapy that is going to follow. And so for those patients, we actually try to resist doing blood work or image tests just because. Testing is not without its own harm. There are false positives. There are occasional side effects, contrast dye to a CAT scan, for example, that can cause rare side effects. And there's worry and anxiety that can go along with living from one scan to another. We want our patients to sort of be not living the victimized role of living from a scan to another, but getting on with their life. So it really depends upon the circumstance.
For sure, and that's part of the thriving process. And it can be very, rattling to be waiting for the results. That certainly people can understand that.
Sure.
We have a live question that came in from Ariana Adams. By the way, she says that she loves you. And she says here, my grandfather and uncle died of cancer. Does that mean that it's in the family? That's a good question I think a lot of people have.
So not necessarily. I mean, clearly it's in her family, but this is what I think she's asking is, does this mean that there is a gene that's being passed from one generation to the next? Kind of goes back to the question I answered earlier. Most family members that have cancer, it's coincidental and it's not genetically predisposed. But again, we look at that pattern. Were the grandfather and the father particularly young when they had the cancer? What type of cancer were they? Were they cancers that are more associated with a genetic predisposition? So again, it really comes down to the details as to whether there might be a genetic predisposition. And one's not sure, you talk to your doctor about it, and maybe a trip to the geneticist is in order.
Excellent. Our next question says here, do you recommend any special diet to rehabilitate your body after cancer treatment? That's
yes, a very healthy diet.
Of course, doctor, yes.
So, I mean, the same thing that I tell my patients is the same thing I told my children when they were 5 years old. I mean, we want diets that are rich in fruits and vegetables, relatively low in fats, saturated fats, relatively low in carbohydrates, not an abundance of processed foods and red meat, although some red meat is okay. So I think a healthy diet has been shown to decrease cancer occurrence, and in some settings probably cancer recurrence as well. Most things in moderation. A lot of times I get a question about, well, what about alcohol? And I think a little bit is okay. Too much, no, not so good. So I think it's just commonsensical approaches. There are a lot of books written about cancer diets. I mean, you know, there are a whole abundance of specialty cancer special cancer diets, and I don't know honestly that that's any better than just eating a very healthy diet, whether you have cancer or not.
Okay, so then you wouldn't necessarily recommend any specific one. That I know there are books out there that'll have cookbooks for those going through cancer, that maybe you can make smoothies or things that are less, that helps you with the nausea and things like that.
Well, if that helps, then that's
then
fine.
yeah.
And there's something to be said about empowerment. So, you know, even a lot of times patients will talk about going organic once they've had a diagnosis of cancer. And we don't know for certain that an organic diet is any safer than an otherwise healthy diet. But for that patient that feels that going organic has given them a chance to be in charge, kind of grabbing the reins of control, there's a lot to be said about that. I mean, empowerment is therapeutic in and of itself. So I understand that too.
Okay, great. Next we have here, this is an excellent question. How do you get over the fear that the cancer will return? And they're undergoing chemo for lymph node involvement. This particular question, person that sent in the question, they had removed their lower right lung, and one node out of 14 had showed cancer. So that is an excellent question about how do you get over that initial fear.
Well, fingers crossed that this person is going to be fine, but fear is normal. I mean, we have to validate the fear. It is an absolutely normal emotion to have when faced with a serious diagnosis like cancer. And so we don't want to deny the fear, but we want to help them come to terms with it. If it becomes a consuming fear, then we've got a problem. So the ways for them to deal with the fear, first of all, accepting that it's not abnormal so that they can talk about it with friends, join support groups. Sometimes that's a really great way of working through a fear, because you want to be surrounded by people that have felt the same kind of fear. I think they're going to have some different insights than even a loved one or a family member who hasn't quite walked in one's shoes. Being sure to be knowledgeable about one's fear, because a lot of patients, when you ask them point blank, what's your expectation about the likelihood of this cancer recurring? I hear a lot of inaccuracies, no criticism of them, but they just don't fully understand. And so they may perceive that the risk is much greater that there's going to be a recurrence than it actually is. So I think it's really important to have a true understanding by talking with your doctors as to what your fear, what your risk of recurrence really is. Being dutiful about going to your follow-up appointments, having your testing done if it's recommended, adopting a healthy lifestyle. We already talked about diet. I mean, that's a way to sort of get ahead of the fear, by being empowered to do things for yourself, so that you're not just sitting around waiting, but you're actively doing things to make yourself feel better and hopefully be better.
Great, good answer. Next up we have, I've heard of the terms long-term side effects and late effects.
Yeah.
They want to know, what is the difference between those?
Well, I guess there's some overlap. I mean, a late effect to me is something that has not been there for some time and then emerges much later. Some of the medications we use, for example, can rarely affect the heart, and maybe there's not a problem with the heart in the years after the diagnosis or the treatment, but maybe 10 or 15 years later, something starts to emerge. So that would be a late effect. The longer lasting effects are things that may have started soon after the diagnosis as a part of treatment that then linger and stay with the patient for a long time afterwards. And we really like to focus on that, especially in survivorship. I mean, so many of these patients are going to live long lives, and we want to be sure that if they are left with side effects and toxicity from treatment, that we are really taking that serious and trying to do the best we can to prevent it in the first place, but manage it if it should linger.
And maintain that quality of life.
Yeah.
It was all part of that thriving process. Here's kind of a two-parter, I guess, question here. Should cancer survivors disclose their survivorship while job searching? That's an excellent question.
Wow. Oh, that's a very interesting
That
question.
might be straddling the legal line a little bit there, but
Well, they are not at all.
Okay.
And nobody is required to divulge any medical information. That is private information that we have absolutely no obligation to convey to somebody. And a prospective employee has no legal right to inquire about your health issues either. So it really is an important privacy issue that has to be maintained. So I guess that decision would be on the part of the person applying for the job. If for some reason they thought that knowledge maybe would create a sympathy on the part of the prospective employer, that they would be more likely to hire them, and that would make the job easier for them as a result, then I could see maybe in select circumstances that might be a choice one might make, but by no means do they need to or are they required to.
great. They can be confidential to you.
Absolutely.
Great, and kind of along the lines of the survivorship, it says here, I've read about survivorship care plans. Does Gbmc offer these, and if so, how can I get one?
So we do. So these are the idea behind a survivorship care plan, or we also have something called a post-treatment summary, is to provide patients with information about the treatments that they've been through, and also literature and links now through the internet about survivorship issues and toxicities and many other things. We have a survivorship person in our clinic who puts together those forms, and if they have not received one, then they simply need to ask, and we can make sure that they can get in to see her to provide that. But many of the things that are on that form, we're also talking about our patients on a regular basis when they're coming in for regular follow-up. So there's some overlap there.
That's great. That's all one of the many services that you do offer at Gbmc, which is great. And our next question is, at what point after treatment are you truly considered a cancer survivor?
Well, as we said at the outset, I mean, you could define it as the day that you're diagnosed, you are surviving your cancer. So that is definitely one common definition.
That's a good way to look at it, yep.
And again, beyond that, it's really a personal choice. I have some patients that define that once they're through their treatments. If they're going to have just initial therapy and no further therapy because hopefully their cancer is behind them or cured, some would like to wait till that first scan is back, as we said, to feel that they've reached a milestone. It's such a personal choice. I don't think there's one set answer to that.
That's great.
Sounds like a vague answer, but it's really
No, but honestly, it's very important that you are continuously kind of specifying it's a case-by-case basis and based on, on the individual patient.
And some of my patients, frankly, don't even like the word survivor. I mean, they would choose to use something different. They say, if their cancer is still there, they may say that they're living with cancer, or they are, it's just different words that they use. I think it's just so personal how one defines it.
Fighter comes to mind, warrior.
Winner. I've had one
survivor.
patient that said she was a cancer winner, and that was her. That was the way that she wanted to frame it in her own mind to journey forward. And more power to her.
Yep, that's excellent. Right here, now our next question says, after a cancer diagnosis, are there specific symptoms that one should immediately address by their doctor, and also which doctor should address these concerns? That kind of explains maybe as people are getting into the process of learning what sort of doctors they're going to need along the way.
Yeah, so I think if there's any concerns that the symptoms might be cancer-related, I think going back to one of your cancer providers is the way to go, whether it's your surgeon or your medical oncologist or your radiation oncologist. And certainly an active primary care doctor can play a very important role, too, as they are also following these patients for a very long time. With regards to symptoms, again, it may be specific to the type of cancer that they had. There are a whole array of different symptoms that can occur from top to bottom, whether it's bone pain, unintentional weight loss, shortness of breath, abdominal fullness or bloating, headaches, visual changes. I'd like to sort of joke with my patients that I've had every symptom of cancer recurrence, not to be funny, but to make a point that it's not just about the symptom, but it's about the atypicalness of the symptom and the persistence of the symptom. Because quite frankly, if every time we had a symptom that could be cancer, we ran out to the doctor, we'd be running to the doctor, very, very frequently. So it really, we try to educate our patients to just watch and see if the symptom gets better. Most of the times it will, and it's not cancer related. But if it's not getting better, or if it's atypical for some reason, then by all means we get them in and we'll work it up.
So I guess how do you, you do hear that whether or not you don't want to be a hypochondriac about things, but you also want to be vigilant and responsible for your own health.
And I think most of that issue is really, it's more of an issue soon after a diagnosis, because this is all new. And you don't know what the normal background noise is when it comes to symptoms that people have. I think in the first year after a diagnosis, we have more struggles with that. As people get further along, that becomes less of a challenge.
And you know, I'm struggling with our horse. We can explain now at the beginning of this Facebook Live, we were talking about, I think I named him Chase after Legacy Chase, which I'm sure folks that are watching are familiar with your now upcoming 17th annual fundraiser for oncology services.
Yes.
At GBMC. We have a date already, so mark your calendars. That is going to be Saturday, September 23rd. Back at Shawan Downs, and you guys broke a record last year for the longest Guinness Book of World Records for the longest awareness ribbon, right?
Yeah, Guinness Books. That's right.
That's so cool. So this little guy here, I think he was just made special. He's kind of a piñata, but he also, more importantly, is sporting these very colorful awareness ribbons, and they each have, you know, you could put a specific name of someone who is a survivor. This is for their, you know, their dad. This is for a survivor and someone specifically. Do the different colors mean anything based on type of cancer?
Yeah, I mean, every cancer has a color, if you will, when it comes to ribbons.
Yeah.
So it's a blended rainbow of all different stories of patients that have been down this path. So yes, and then there are many other colors beyond those too.
Oh, yeah, so we're going to definitely add to him. This is a very early prototype. And where you can see him, this is really cool. Coming up this Saturday and Sunday is, of course, the Towson Town Festival, which is, you know, the East Coast, let's call it the East Coast largest, you know, community event. It's going to be great. You guys are going to be there with a booth on Chesapeake Avenue, both Saturday and Sunday. And folks will be able to stop by your booth and get the latest information, the latest services that you offer, as well as a chance to meet Chase here and to add an awareness ribbon to him. And get us all ready for Legacy Chase.
Yeah, and Legacy Chase is really wonderful. It's just been the last several years where this has been, the cancer services at GBMC have been designated the beneficiary of the Legacy Chase fundraising. But it's a real great blending of a great Baltimore tradition with the horse racing and such an important program here in town. So we're really happy to be part of it.
It really does, because it's, you know, horse racing is so huge in this area, and Hunt Valley is gorgeous, and people like that normally look at Preakness and everything else, but this has such a special meaning for you guys, and you're the very worthy beneficiary of the money that helps you continue to serve families who are going through the cancer diagnosis and ultimately thriving and surviving with your help, Dr. Donegan. It's been such a pleasure to have you here with us today. Thank you. Yeah, thank you. Well, I look forward to doing this again soon, and please come out and see GBMC at the Towson Town Festival this Saturday and Sunday. You can see him along Chesapeake Avenue, and you can look for Chase, our cute little piñata awareness ribbon horse, and we'll see you at Legacy Chase Saturday, September 23rd. And thank you, guys. We'll see you again soon. Thank you for all your great questions. I'm Gina Crash. Thank you for listening to today's 101.9 and supporting GBMC.